So you're about to go for a run, but you're still feeling some pain from your last workout because this is what running does. Or is it? Could this be an injury that requires some rest? Or is it something that'll disappear on its own and you just need to run through it? Let's find out if it's okay for you to go for that run. Ooh, ah, ooh. Well, that transition's not working. That's a really valid question, and a lot of you ask me about it, because depending on your decision, you could either complete your training plan according to plan and be stronger for it, or set yourself up for a multiverse of dysfunctions, compensations, pains, injuries that could force you to stop. So today, I hope it can help you make a decision about whether you should push through and go for that run, or whether you should rest it out. We'll approach this with 3 main aspects. First one, location of the pain. Hey, the editor. Location on the body, not on the map. If you feel pain in the belly of the muscles where it's nice and fleshy, especially if it's symmetrical on both legs, for example, then maybe you just had a tough session that your body wasn't ready for. In that case, it's probably all good, just keep on going. If, however, you're hurting in your joints, particularly in your ankles and your knees and your hips, perhaps in your back, then maybe you should sit that one out. The joints are usually where the tendons sit, and they're definitely where all the ligaments and the cartilages are. Knee, tendon, ligament, 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 meniscus, cartilage, cartilage, cartilage. Your back is also a bunch of joints stacked together. So if you're feeling pain in the lower back, it's probably a good time to focus on strength and mobility. Tips on the lower back up here. If you're feeling pain on the bones, well, running shouldn't hurt the bones. For example, if you've got a tender spot right on the shins, this could be a stress fracture, not shin splints. So maybe go for a one-on-one consultation with a specialist. And of course, don't go for that run. If you're experiencing soreness just on one side, well, running is a very symmetrical sport, so there's no reason for you to have one side that's more sore than the other, unless you have something going on. So rest that one out and then spend some time working on your asymmetries. Is the mobility or the strength on one side different from the other? Before we go to the second parameter, salut! This is Stéphane from Safe Motions. Please like this video if you're enjoying it. The type of pain. Numbness, tingling, sharp shooting pains. These could mean a lot of things that may be worth checking, like trapped nerve, for example. Yikes. It could also be a stress fracture in the foot, in the hip. The problem with stress fractures is they're not always sufficiently painful to force you to stop running. So you might feel like, I can still push through. If that pain in the foot, in the shins, in the hip is not getting better and it's always preventing you from walking normally going back home, please get a specialist to investigate. Because running with a stress fracture, even if you physically can, is a no, 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 no. Full rest, no running. Respect that minimum amount off of your feet. If your type of pain is a symmetrical kind of soreness right in the belly of the muscles, as I said earlier, it's probably okay for you to keep on running as long as it progressively reduces over time. Which leads me to the third parameter, timing of the pain. If your pain does not get worse and floats around maybe 3 out of 10, 10 being the maximum, then perhaps all you need to do is change your training program. Integrate more easy runs in your week and maybe think about more progressive loading. That'll give you time to rebuild the tendon strength and the muscle strength. If, however, you're feeling pain that's just about enough to make you change your form and sort of work around the pain, it changes your gait, even just a little bit, then you're risking for those symptoms to increase over time, and worse, you're risking creating compensations that in turn may lead to further injuries. So rest this one out, work on your weaknesses, make sure that when you run, you're symmetrical. If it still hurts, go consult a specialist. Injuries and rest time can be the opportunity for us to get better, work on our weaknesses, and use the time that we used to run in to do some strengthening, to make our bodies a bulletproof running beast. So when in pain, think about where it hurts, how it hurts, when it hurts, and I hope with that you can make the right decision. I'll see you in the next video. À bientôt!